Now, if we're looking at healthcare here in Canada, we have the universal healthcare system, which everyone keys into a number that's held by the federal government, and all of our healthcare records are kept on file. I think one of the challenges you had there in the US was that even the labs were not communicating with each other. So initially, the assessment of the number of COVID patients that you had across the US was constrained by by not having accurate numbers to be able to deal with those issues. How has that changed, and have healthcare agencies struck up partnerships with companies in innovations to keep up with the speed of change that's occurring right now? Ravi, what's happening within India? Is that happening there?
Dr. Chalil mentioned 2 points, okay? And I'm glad he mentioned that. One was word cloud. It's very important. I'm going to make this a little bit tech. It is very, very interesting that cloud has actually brought cost of compute so low. But if you look at healthcare industry per se, they have not taken advantage out of it. For the first time in the history of computation, the cost of compute is so low that you should not spend cash and precious cash liquidated in terms of storing data, analyzing the data, and then trying to improve quality of life. Second thing which he mentioned is a simple point, but it's a remarkable point, is an accessibility or restriction of a doctor to a particular area. I call that as a sin. That should never happen, especially in this world. Look, you can use tech in either ways. You can either see it in a positive, like so many things, or you can actually use it as a great, great tool, technique in a healthcare. If these two things go away, then the relevance of your question changes dramatically. Okay, and that's why I wanted to make this particular point. Look, if you actually go to any healthcare facility, okay, and if you leave doctors and the art and science of cure separate, there's so many other things which happen in a healthcare facility. One, who talks to patient? Why do you talk to patient? How do you interact with patient? How long is that interaction of the patient? Who should actually do the interaction? Okay, let's take an example of robotics. If you look at auxiliary robots, okay, they can take lot of precious time which doctors and nurses and other healthcare workers spend with patients, okay, at a hospital, and put it to a productive use. I think that has to come. I don't think it requires any regulatory change. It just requires a mindset change, okay, so that nurses can spend more time with actual patients and solving problems or helping them, rather than doing bringing medicine or finding medicines in stores or doing things related to that. Other thing is in terms of what Dr. Shalil mentioned, and it's very important, is daily tasks and the mental health care. Okay, this record keeping of hospitals and healthcare, what they have done is that they have just taken the paper-based system of records and they have converted into a digital system-based record. So great. So now you are sure you have a paper trail into a digital trail, which can help you in forensics. That's an extremely negative thinking. It's not a proactive thinking in which you use analytics to solve and find out the history and use that history to solve problems or predict potential diseases. I don't think that is happening, and that's where. And that requires to trust doctors a little bit more and give them a little bit more freedom. And that's where the core of healthcare is there. Everyone talks about, the supply chain part of healthcare. I think focus should be people who are at the center of it, which is doctor and patient. It should not be a lawyer-like arrangement. Currently, it's more like a lawyer-like an arrangement than profession of curing people with this. Remote treatment is necessity. Okay, I don't think education system globally, whether it is US or whether it is India, okay, which fundamentally one is known for its institutions, other is known for number of practitioner it produces. Even if you take India, still it is not possible to ensure physically presence of a doctor, okay, to do diagnostics. Forget about curing, to even do diagnostics. I think everyone should, more than regulation or discussion, this is a common sense issue, okay? I think common sense should prevail, and they should just they should make it boundaryless. And they should make boundaryless with maybe an international body or something like that. I don't know whether that exists, but that has to happen. It may start with US as a country, but that has to happen, because as a technologist, that's the simplest thing which you can do. And people are doing now, if you actually look at. The other thing is bringing commodity technology. And Dr. Shalin mentioned a very important thing, robotics. And you're talking about specialized robotics with specialized companies and so many regulations to ensure that instrumentation can be. I think healthcare should open up. For the first time, again, the history of computation, enterprise or specialized technologies are laggards, and the commodity technology, the phone which you use, the apps which you use, the technology, the platforms behind those apps, they are far more accurate and far more cheaper. I think that adoption needs to happen. Commodity robots should be adopted, and then certain part of machine learning which is highly accurate, which churns data much better than human brain because of the enormity and volume of that particular data. I think those things should be accepted. So I would focus on these very simple, real issues which are surrounding doctors and nurses. And once we are able to solve those, and then we can talk about bigger issues which are structural in nature or mostly related to accessibility and infrastructure. But these are pretty straightforward, simple commodity issues which can be solved by commodity tech.